pregnant or known to be pregnant, adjust your hand position to be slightly higher on the chest and give compressions at the usual depth and rate.
If you assess a child and find no movement, breathing, or pulse, give CPR using the same technique and rate you used for an adult. Cycles of 30 compressions and 2 rescue breaths. The hand position on the center of the chest is the same. But for a child, do not compress the chest as far as for an adult. Compress the chest for a child about 1 to 1.5 inches deep. The compression rate for a child is the same as for an adult, about 100 compressions per minute. After 30 compressions, give 2 rescue breaths. Watch for the chest to clearly rise to make sure the breaths are effective. If at any time you notice an obvious sign of life, stop CPR and monitor the child's ABCs.
8 and 9 and 10 and 11 and 12 and 13 and 14 and 15.
You may also choose to give CPR for a child using the one-handed compression technique seen earlier during the unconscious choking video segment. Compression cycles and rates are the same for one-handed child CPR as they are for two-handed child CPR. 30 compressions and 2 rescue breaths per cycle at a rate of about 100 compressions per minute.
Baby, are you okay? This infant is unconscious. Call 911.
CPR for an infant is similar to a CPR for an adult and child, but uses the chest compression technique you learned for an unconscious choking infant. Keep one hand on the infant's forehead to maintain an open airway. Place 2 or 3 fingers on the center of the chest just below the nipple line. Give 30 chest compressions. Compress the chest of an infant only about 1/2 to 1 inch deep. Keep the down and up motion smooth. Let the chest come all the way back up before you press down again. When you come up, don't take your fingers off the chest, just take the pressure off the chest. The compression rate for infants is the same as the rate for adults and children, at least 100 compressions per minute. After 30 compressions, give 2 rescue breaths. Each rescue breath should last about 1 second and make the chest clearly rise.
1, 2, and 3.
If at any time you notice any obvious sign of life, stop CPR and monitor the infant's ABCs.
14 and 15 and 16, 17, 18.
To review, if during the initial assessment you check an unconscious victim and find no movement, breathing, or pulse, begin CPR. Position your hands on the center of the chest and give 30 chest compressions. Compress the chest about 1.5 to 2 inches deep. Give 2 rescue breaths, each lasting about 1 second.
9, 1,000, 10, 1,000.
For a child, follow the same steps but compress the chest only about 1 to 1.5 inches deep.
5 and 6 and 7 and 8 and 3.
For an infant, the steps are also the same, except when giving compressions. Use one hand to keep the airway open, and with the other hand, give compressions using 2 or 3 fingers on the center of the chest just below the nipple line. Compressions for an infant should only be about 1/2 to 1 inch deep. If at any time you notice an obvious sign of life in a victim of any age, stop CPR and monitor the victim's ABCs. Two rescuer CPR is more efficient than one rescuer CPR. Good communication is vital when 2 rescuers give CPR together. Notice how these rescuers communicate as they work together.
1,000, 1,000.
As rescuer 1 looks for movement and checks for breathing and a pulse, rescuer 2 waits at the victim's side for further instruction.
1,000. No pulse, begin CPR.
Rescuer 2 quickly moves into place by positioning her hands on the center of the victim's chest and gives 30 compressions.
13 and 14 and 15 and 16 and 17 and 18 and 19.
Counting out loud helps rescuers work together.
24, 25, 26, 27, 28, 29.
After 30 compressions, rescuer 1 gives 2 rescue breaths. Each breath should last about 1 second. Both rescuers continue in these positions, one giving compressions and the other giving breaths until they complete about 2 minutes of CPR. After 2 minutes, the rescuers change positions. Rescuer 2 calls for a change on the 30th compression at the end of the 2 minutes. After the 2 rescue breaths are given, Rescuer 1 removes his resuscitation mask and Rescuer 2 moves to the victim's head to give rescue breaths.
11, 12,
Rescuer 1 moves into position and gives compressions, while Rescuer 2 maintains the airway and gives rescue breaths, using her own resuscitation mask.
26, 27,
Changing position should take less than 5 seconds. If at any time either rescuer notices any obvious signs of life, announce the command to stop CPR and monitor the victim's ABCs.
8, and 9.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13.
2 rescuer CPR for a child follows the same steps as for an adult, except that when 2 rescuers are working together on a child, the compression cycle changes to 15 compressions and 2 breaths.
13 and 14 and 15.
Changing positions is also the same for a child, except that the rescuer who is giving compressions calls for a change on the 15th compression at the end of the 2 minutes.
11 and 12 and 13 and 14 and change.
Rescuer 1 removes his resuscitation mask and Rescuer 2 moves to the victim's head to give rescue breaths.
3 and 4 and 5 and 6 and 7.
Rescuer
and 8,
1
9,
moves into
10,
position
11,
and gives
12,
compressions.
13, 14.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and
2
11
rescuers
and 12
giving
and 13
CPR
and
to an
14 and
infant should use the 2 thumbs encircling hands technique. Place a towel or other padding under the infant's shoulders to support the shoulders and help keep the airway in a neutral position. To give compressions, place both hands around the infant's chest, supporting the back with your fingers. Place your thumbs next to each other on the center of the infant's chest just below the nipple line, making sure not to compress the lower end of the chest. Make sure your hands do not squeeze the infant's sides, chest, or torso. Use both thumbs to compress the chest about 1/2 to 1 inch. Give 15 compressions.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11.
The second rescuer maintains the open airway and gives rescue breaths.
1 and 2
The compression rate is the same for all victims, at least 100 compressions per minute.
12 and 13 and 14 and 15.
But when there are 2 rescuers, the cycle for an infant, like a child, becomes 15 compressions followed by 2 rescue breaths.
9 and 10 and 11 and 12 and 13.
The up and down motion of the compression should be smooth. Allow the chest to come all the way back up before pressing down again. Take the pressure off the chest without taking your thumbs off the chest. The position change for an infant works the same way as for a child. Change positions about every 2 minutes. The rescuer who is giving compressions calls for a change on the 15th compression at the end of the 2 minutes.
And 11 and 12 and 13 and 14 and change.
To review,
24, 25, 26, 27, 28.
when 2 rescuers work together to give CPR, one rescuer gives compressions, while the other maintains the airway and gives rescue breaths.
4 and 5 and 6 and 7.
Change positions about every 2 minutes. Communicate with your partner to ensure a smooth change.
10 and 11 and 12 and 13 and 14.
2 rescuer CPR for a child follows the same steps as for an adult, but for a child give 15 compressions and 2 rescue breaths in each cycle. Change positions every 2 minutes.
13 and 14 and 15.
1 and 2 and 3 and 4 and 5 and 6 and
2
7
rescuers
and 8
giving
and 9
CPR
and
to an
10 and
infant
11
should
and
use the
12 and
2
13
thumbs
and 14 and
encircling
15.
hands technique. Give 15 compressions and 2
1
rescue
and 2
breaths
and
in
3
each
and 4
cycle
and 5
and change
and 6
positions
and
every
7
2
and 8
minutes.
and 9 and 10 and
Changing
11 and
positions
12
should take
and
less
13
than
and
5
14 and
seconds.
change.
Every minute of every hour, 24 hours a day, year after year, without rest, your heart pumps blood through your body. The rhythm of a normal heart is constant. If for some reason this rhythm is changed or interrupted, the heart may no longer be able to pump blood effectively, depriving the body of oxygen and leading to death. The heart is a complex organ divided into 4 chambers. The upper chambers are atria. The lower chambers are called ventricles. Blood flows from the atria to the ventricles and then to the rest of the body. The contraction of the heart muscle is triggered by an electrical system contained within the heart. In a healthy heart, an electrical impulse comes from a point near the top of the heart called the sinoatrial or SA node. The impulse travels down to the atrioventricular or AV node, near the bottom of the right atrium. From the AV node, the impulse spreads across the ventricles, causing the muscles to contract and force blood out of the heart. The electrical activity of the heart and its rhythm can be measured by a heart monitor that displays an electrocardiogram, or ECG. The peaks and valleys of each wave, their size, shape, and frequency show the heart's rhythm and how the electrical system is functioning. This ECG shows regular electrical activity called normal sinus rhythm. A cardiac emergency occurs when the heart does not function properly and blood does not reach the brain and vital organs. The 2 most common types of cardiac emergency are heart attack and sudden cardiac arrest.
Heart! Heart! Heart!
A heart attack is caused when arteries or blood vessels in the heart become blocked and the heart muscle is deprived of blood and oxygen. The heart's electrical system may still function, but the heart is unable to pump blood through the body effectively, resulting in a life-threatening condition. A person suffering a heart attack may be fully conscious and alert and may or may not experience pain or other signals of a heart attack.
Mom, are you sure you're feeling okay?
They'll get a touch of the flu, that's all.
A heart attack may also lead to cardiac arrest. Cardiac arrest occurs when the heart's electrical system malfunctions and the heart rhythm becomes irregular or too fast.
Mom!
Under these conditions, the heart can no longer work as a pump and cannot move blood and oxygen through the body.
Megan, call 911 and tell them your mom's unconscious.
A person suffering cardiac arrest may become unconscious, stop breathing, and have no noticeable pulse. This does not necessarily mean that the heart has stopped functioning completely. One of the most common forms of cardiac arrest occurs when the heart simply quivers without any organized rhythm. This condition is called ventricular fibrillation, or VFib. In VFib, the electrical impulses fire at random, creating chaos. The heart is unable to circulate blood, therefore there is no pulse. When there is no pulse, one way to halt VFib and restore normal electrical activity is with an electrical shock known as defibrillation. The shock stops the heart for an instant and allows it to